Hello students, welcome to All About Nursing channel. So today's video is going to about how to read an ECG or how to read the ECG graph. Okay. So before knowing the ECG reading, so we have to know the leads and we have to know which leads are denoted which area of heart. Okay. So you can see the pink color is denoted at left anterior descending artery. The yellow color denoted that left circumflex artery, and the green color is denoted at RC or right coronary artery. So in previous video I have discussed that ECG, the leads, what are the leads are there. So in the precordial, there are precordial and the arm limb leads are there. So if we are seeing that from the anterior portion of the heart, the anterior wall which is denoted through V3 and V4 lead, okay, and anterior septal wall is denoted with the lead of V5 and V6, and the inferior wall of the heart or inferior area of the heart is denoted through the lead 2, lead 3 and AV augmented lead, okay, and the lateral wall is denoted with the lead of lead 1 AVL and the AVR, okay, and the septal wall is denoted with the V1 and V2. So you can easily remember it by the placement of the lead. So V1 and V2 is placed at the fourth intercostal space and both the sternal edge, okay. So that denoted the septal area of the starting precordial lead V1 and V2, which is the septal, which denoted the septal wall. Then the V3 and V4 coming to the next lead, that is V3 and V4 of the precordial lead, that denotes the anterior wall of the heart, and V5, V6 are denoted anterolateral wall, and the lateral wall is denoted with the 1 AVL and AVR, and inferior wall is denoted with 2, 3 and AVF. So that is written here that from the inferior portion you can see this is the inferior side. So which leads are seen, that 2, 3 and AVF, that is the inferior, that denotes the inferior wall. Next, coming to the lateral wall, that is AV. The lateral wall is denoted with the V5 and V6. You can see the V5 and V6 we denote the lateral wall of the heart, okay, and the anterior wall of the heart is denoted with the lead of V3 and V4, two leads, and the septal wall which is denoted through V1 and V2, because the placement of the lead of the ECG, that is V1, V2, V3, V4, V5 and V6, though the precordial lead, so the V1 and V2 are placed at the septal wall of the heart. That's why it denotes the septal area of the heart, okay. So if we see the ECG, here you can easily identify the ST segment elevation in which area. So you can see in the V2, V4, V5, okay. So V4, V5 which denote the anterior wall, okay, and the lateral wall. So here you can see there is AC segment elevation is there in the AVL, that is elevation is there, and as well as in the V4, V5. So that denotes the anterolateral infarct. Next, if you see in this ECG here, you can see the inferior area, means in the lead 2, lead 3, AVF, there is AC segment elevation is there. So that denotes it is the inferior wall MI. So by this, by remembering all the leads which supplying or which denotes that which area of heart, like V1, V2, that denotes the septal wall. So by remembering this, you can easily check that, you can easily interpret the ECG in which area or which aspect of the heart is affected or damaged.